What Nipah virus is? Nipah virus (NEV) is a henipavirus, a zoonotic virus that spreads from animals to humans. Natural reservoir. Fruit bats, flying foxes are considered the main natural hosts. Severity. It can cause severe disease in humans, including brain infection, encephalitis, and respiratory illness, with an estimated fatality rate of about 40 to 75%. Current situation in India, 2025 to 2026. Recent cases: India reported 2 laboratory-confirmed Nipah virus cases in West Bengal, Assat, North 24 Parganas district among healthcare workers at the same private hospital. Timeline. Infections occurred in late 2025. Confirmation came in January 2026. As of late January 2026, 1 patient remained on mechanical ventilation. The other had severe neurological illness, but improved. Contacts and spread. Over 180 to 190 contacts were identified and tested, all tested negative. No additional cases have been detected. Authorities consider the outbreak contained and not major, though taken very seriously. International response. Several Asian countries. Thailand, Malaysia, Singapore, Hong Kong have tightened airport screening for travelers from India, but WHO currently assesses the risk of further spread as low and does not recommend travel or trade restrictions. Past Nipah outbreaks in India. Kerala outbreaks, 2018. First recognized Nipah outbreak in Kerala, with multiple deaths. Subsequent smaller flare-ups occurred in 2019 and 2021, for example. Kozhikode, all contained with aggressive public health measures. India has built specialized lab capacity, contact tracing, and isolation protocols based on these experiences, which is part of why recent clusters have been limited in size. How Nipah virus spreads. Main routes of transmission: animal to human, contact with fruit bats, or their secretions, saliva, urine, feces, consumption of food contaminated by bats, such as raw date palm, sap, or fruit partially eaten by bats. Human to human, close contact with infected people, especially their respiratory droplets, body fluids, or contaminated surfaces, for example, in households or healthcare settings. There is no evidence that the virus spreads isolated in the general community like seasonal flu or COVID-19. Most chains of transmission have been limited and linked to close contact. Symptoms and disease course. Incubation period: time from infection to symptoms, typically 4 to 14 days, but can be longer in some cases. Common early symptoms: fever, headache, muscle pain, sore throat, fatigue. Progression in severe cases: dizziness, confusion, drowsiness, seizures, encephalitis, brain inflammation, respiratory distress, cough, difficulty breathing. The disease can progress rapidly, and severe cases may require intensive care. Diagnosis, treatment, and vaccines. Diagnosis confirmed through specialized lab tests, RT-PCR, ELISA on blood, throat swabs, cerebrospinal fluid, or other samples. Usually done in high-containment labs, like India's National Institute of Virology, Pune. Treatment. There is no specific antiviral drug proven for Nipah virus yet. Care is supportive, managing fever, breathing, brain swelling, and complications in hospital or ICU. Vaccines. As of early 2026, no licensed human vaccine is widely available. Research and experimental candidates are ongoing. Prevention and what people in India are advised to do. Public health authorities, and who emphasize basic but strict precautions, especially in affected regions. Avoid bat-contaminated food. Don't drink raw date palm sap. Avoid fruits that look bitten or partially eaten by animals. Limit exposure to sick individuals. Avoid close contact with people who have unexplained fever and severe respiratory or neurological symptoms. Follow hospital infection control measures strictly if you're a healthcare worker or caregiver. Hygiene. Wash hands frequently with soap and water. Use masks and gloves when caring for sick people, if advised by local health authorities. Follow official advisories. India's Ministry of Health and state health departments issue guidance on quarantine, testing, and movement in affected areas. Stay alert, stay informed, and follow advisories is their core message.